So for us, it's not just a mere freeze, it's a freeze on our lives.
At Parliament today, the Parliamentary Health Committee hosted a meeting with the HIV and AIDS agencies to discuss the issue of the President Donald Trump's suspension of US aid in the field of HIV and AIDS to countries including Uganda.
That the estimated number of people living with HIV is 1,492,000, and this is as of December 2023. Out of the 100 people living with HIV in the world, 4 are actually Ugandans.
During the discussion, it was revealed that funding from the US President's emergency plan for AIDS relief supported, among other things, the payment of 4,333 clinical workers in 2,000 areas, as well as 16,690 community health workers and lay workers across 2,000 health facilities in the country. The Director of Planning and Strategic Information at the Uganda AIDS Commission therefore called for funding of over 300 million to cover the functions previously supported by PEPFAR.
Parliament of Uganda, together with Ministry of Finance, Planning and Economic Development, should redirect the budget priorities and increase funding for HIV services with an additional lump sum of 300 billion Uganda shillings. And the 300 billion is to compensate for the amount that PEPFAR has been putting in.
HIV advocates also tabled the need for Parliament to approve emergency funds of over 2 billion to bridge the gap created by the funds withdrawn from HIV and AIDS agencies by the US.
If a supplementary budget of about maybe just 2 billion to start off, a task force that helps us to start an emergency task force for Ministry of Health, for AIDS Commission, for our development partners to say, where do we start? How do we start looking for these who have been lost to follow up that are coming?
Responding to the request, MPs acknowledged the need, however, decrying the continued disbursement of monies to unworthy investments and corruption that is robbing the country of development.
Definitely, just to save the situation, pass that money. But we should also put it in mind that there could be some people who are lining up to make a big catch out of this money. Our biggest problem is corruption.
We have been budgeting for such money under a vote under Ministry of Health, but that money has not been serving the purpose. And even the money that has been flowing into Uganda from abroad to help such victims has not been fully put into use.
Government of Uganda just have to prioritize appropriately. Why is it that this government cannot invest under areas of research? We have told them earlier in Parliament that they should be able to invest under areas of research, especially where we have homegrown solutions.
This withdrawal of funds continues to cause disruption and uncertainty on way forward for HIV care programs in Uganda.